Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Towson, Maryland, discussing advances in cosmetic eyelid surgery and how they can help you look and feel years younger with one of this area's top ocular facial plastic surgeons, Dr. Darab Hormozi. Dr. Hormozi is board certified and graduated cum laude from the University of Brussels Medical School in Belgium, one of the top medical schools in Europe, and has completed his ophthalmology residency at Maryland General Hospital in Baltimore, Maryland. He is the leading oculofacial plastic surgeon in the United States and gives lectures on state-of-the-art bladeless radiosurgery nationwide. Welcome, Dr. Hormozi.
Thank you.
Oh, it's our pleasure to have you on. We've got a lot to talk about regarding a very important cosmetic topic that has been out there and about as far as people having questions on how they can look younger, feel better, certainly eliminate the problems that people have with their eyes and within the eyelids. And I wanted to begin by asking you if you can please tell us, I guess for backdrop purposes, what are some of the most common problems that people experience with their eyelids?
Some of the more common problem right now, it's basically aging. Aging around the eye, puffiness of the lower lid, sagging of the upper lid. People don't like to look older. The generations of people working longer, older, they don't like to be treated as an older person. So the puffiness and the sagging of the upper lid has been really the major concern for baby boomers.
Yes.
Which everybody is getting there.
Exactly.
And also younger patients, they don't like that. But when they know there is a solution, they want to have that solution applied and basically look younger.
Well, speaking of that solution and these advances to correct those problems, can you please tell us what some of those are?
Upper lid surgeries and lower lid surgeries years ago was done on the general anesthesia. And even now, there are some surgeons, they do it on the sedation anesthesia, which basically patient is out during the surgery. I have done basically changed the technique to do it completely local anesthesia. Has been very successful. They don't have to take off the way they would take off with the general anesthesia. They're not sick. They don't have all the side effects of the anesthesia. Even sedation anesthesia, that you have anesthetic in your vein, your system is basically paralyzed during that time, or your mind is not working properly. So I don't have to do any of those. They're all completely local anesthesia. It's an experience which is very similar to going to the dentist office, except there's no drilling.
That's right. You don't have to worry about drilling. And I think that's very important, that point you made regarding local anesthesia, because this way you're awake.
Absolutely.
The patient is awake. He or she is right there talking with you as you're performing the procedure.
That's part of the surgery, is to basically make them comfortable. So I talk to them, we talk about everything they want to hear or they want to know about, or just talk about families or their children. And interestingly, by the time it's finished, they usually say that was it, because I didn't feel anything and it's over. Upper lid surgeries take me about half an hour to do it. Lower lid surgery, yes. Lower lid surgery is about half an hour, and the whole thing 45 minutes to an hour, and it's done and finished. Patient gets up and just walks out.
Oh, so we're not looking at something that one might, from the outside, without knowing that, would think that might be several hours, but it's not the case. In fact, you just said no more than about a half hour to 45 minutes tops.
That's correct.
Very interesting. And how would these eyelid procedures be performed?
As I said, they're performed in local anesthesia. I just give a small injection of the anesthetic underneath the skin for the upper lid, same as the lower lid. The maximum patient feels is a pinch of the skin. That's all they feel, hardly anything.
That's nothing.
Some, they don't even feel it when I'm doing it.
I feel more than that when I get an injection sometimes if I have the flu or something.
Absolutely. So interestingly, the eyelid is not as sensitive as you think. Any person can pinch their eyelid and see it doesn't feel that bad. It's not such a sensitive area. So once it's numb, the eyes are closed, they can't see anything. So that element of worry about the surgery done around the eye is not there. They don't see what I'm doing. So what I'm doing, I remove the excess skin, reposition the eyebrow, all done at the same incisions. And once it's finished, I sew everything back together, one stitch in each side. So very easy to maintain it, keep it clean, and post-operative care is very simple for the upper lid. As I say, it takes about half an hour to do it, and they get up. Now they need somebody to drive them home. It's the same as after dentist, you don't want to eat right away. Here they need to have somebody drive them home. They put ice compresses on the eye the day of surgery to minimize the bruising. The next day they start some hot compresses. About 3 or 4 times a day, 10 minutes, and every day gets better and better. Most of my patients, basically, they go back to work after 3 or 4 days.
This sounds like a very efficient, obviously very not time-consuming. You're only talking about 45 minutes max, and minimally invasive at the same time type of a procedure that can produce, I'm sure, very impressive results.
It does. It does. It makes the patient look younger. Upper lid is basically a reflection of the age. Upper lid and eyebrow. If you want to look, see how you will look about 10 years from now, just pull your forehead down with your hand in your eyelid, and that's what you're going to look like. Yes. The aging process makes the eyebrow and the eyelid sag and come down. So the surgery is to reverse that, to make it more open look to the upper lid. In women, they like to have makeup that shows instead of smudging underneath the skin. In men, is basically they like to have a better view of they don't have that sagginess of the upper lid and the eyebrow. So that's the correlation between the upper lid surgery and aging. It makes you look younger, as opposed to lower lid, which gives fatigue look. When you have puffy lower lid, it makes you look tired.
Yes.
If you have friends who have puffy eyelid in the morning, the first question is, did you sleep last night? Why are you so tired? Why are you so puffy? That's fat. Has nothing to do with anything else. It's a fat, and usually it's genetic fat. If people look at the parents, they will see where it's coming from. The genetic is right there. And the lower lid surgery, I do majority of them through the inside of the eyelid, so there is no cut outside.
So you're not looking at really any scarring as a result of that technique?
There's no scarring. The shape of the eye is not changed. You don't look more slanted or rounded. It's the same eye. It doesn't change the expression. For me, the most traumatic thing for a patient is to look at the mirror and say, that doesn't look like me anymore. Or the husband looks at it and says, honey, you don't look like my wife. Or vice versa. Telling your husband, you don't look like the man I married. So the eyes are basically the center of the shape of the face, and what that gives you the age, the tiredness, the expression of your eye. You know that if you want to cover the identity of somebody, you just put a strip on the eyes, because that's what gives the person's personality.
Well, the eyes are the first thing one looks at when you meet someone or see someone, generally speaking.
And majority of them.
Yes, and it sounds to me, based on what you've described here, that obviously we all want to look better, ideally years younger, which helps us feel better, which are totally related, as we already know. And in this case, it sounds like this technique, this advancement in eyelid surgery, basically we're talking about Ponce de Leon's fountain of youth here.
Well, it is a surgery. We have to remember, this is surgery. It's not magic.
No, but it's minimally invasive.
Yeah, minimally invasive.
You're looking at no scarring, and it takes about 45 minutes.
That's correct.
Tops.
That's correct. And the beauty of it is you always look natural afterward. Majority of my patients, they enjoy the fact that nobody knows they had surgery.
Yes, that's the ideal.
Absolutely.
To look younger without having others realize or notice that you may have had a procedure to look younger. In other words, that sounds like it.